Hi guys, still on the Rcgp Sca sample cases. Let's look at the second sample case. This one is about a patient called Benny Paroleka, and the presenting complaint is eczema. Instructions to candidates. Patient's name Benny Paroleka. Age 2 years. Benny was seen yesterday by another GP in the practice. And yesterday, Benny was noted to have mild infantile eczema, flexures and neck, and the eczema was not infected. Benny was brought in yesterday by her nanny, that's her granny, her grandmom. She was thriving and happy, and your GP colleague yesterday prescribed emollients and 1% topical hydrocortisone. Benny's past medical history. Benny is up to date with his or her immunizations. Benny was born at term. 6-week baby check was normal. At the age of 14 months, Benny had a viral wheeze. At the age of 8 months, Benny was noted to be a fussy eater and was seen by the health visitor. At the age of 7 months, Benny had eczema, which was mild. At the age of 5 months, Benny had an upper respiratory tract infection. Questions for discussion and notes. Is there any helpful information in the case notes to read before starting the consultation? Of course, it's important to note Benny's age. So Benny is Benny is 2, so Benny is a child, a 2-year-old child, and Benny was seen by your colleague just yesterday. So the question is, what has made them come back today? There's a possibility Benny is not getting better. She was thriving and happy yesterday, had a non-infected eczema. So what's gone wrong? Is it about the parents not being satisfied with the explanation, or the parents' worries, their concerns probably were not met, were not fully explored, and they're still worried? Or was it an unmet expectation? Or is Benny actually worse today? So you need to find out, why have they come back today? That's something you need to find out. And you also need to note the fact that she was well in herself the previous day. You need to also note that on her past medical history, there's nothing very serious. But you also need to note that obviously she's had a viral wheeze at the age of 14 months, and she's had eczema before as well. But apart from that, she's been fine, you know what I mean? Next question says, what do you think about the management of Benny's condition so far? So your colleague yesterday, the previous day, prescribed emollients and 1% topical hydrocortisone. I think that's appropriate in terms of eczema. Obviously, other things we need to explore is, are there any identified, possible triggers, any patterns that have been noticed, any particular foods, any particular, materials, clothing, are there dogs, are there pets, are there cats at home, dust mites? Are there things that they suspect may have brought this eczema on? Any particular body lotions, any particular bath, soaps or bath lotions that have they kept a symptom diary to identify possible allergens or triggers? You need to explore that. If they've not done that, you need to be explaining that they need to keep a symptom diary. It can help identify patterns. Why might Benny's father, Alan, have booked this consultation, given his son, so Benny is a boy, given his son was seen only yesterday? Why is he worried? And what are his concerns? Exactly. Are there concerns? Were his concerns explored? What expectation was he having? And was that expectation met? If his expectation was not right, was it explained to him why his expectation was not being met? So we need to find out his concerns and expectations. How might you explore these concerns? First of all, you ask, is there anything you're particularly worried about? Especially as regards Benny, and especially with the rash, the eczema, Benny's got. So by the time you ask that question, is there anything you are hoping for? I know my colleague has prescribed some emollients and 1% hydro. Is that what you were hoping for, or is there something else you were hoping I will be doing to help? So you explore, the dad's expectations. How might you establish trust and an ongoing supportive relationship with the family? By being kind, by being attentive, by giving them time to speak, by using open questions. Because open questions are usually non-judgmental questions. When you ask too many closed questions, then it sounds like you're trying to push them into a box. And that might not be the box they want to be pushed into. So open question means you care about hearing things from their own point of view. What advice and explanations might you offer? You might need to reiterate if your colleague has not already done, but very likely your colleague would have explained to them why there's an eczema. You need to reiterate that this is an eczema, very light, that in most situations it's an atopic, it's an allergic kind of rash, that it usually happens when Benny's body or her skin, is reacting to something it does not like. So what it means is that we need to find out possible triggers, as to why she's having these allergies. What are your thoughts? Have you thought about anything that might be her body might not like? Is it food? Is it the bath water? Is it the bath solution, the gels, these bathing soaps and gels and lotions? Is it clothing? Have they got pets? Have they got rugs, dust mites? You need to be thinking and having this conversation, making them think along with yourself. I'm just thinking, are there things that might be causing this? Are there things that might be making, Benny's body break out in this eczematous rash? And the parent is also thinking along with you, like, okay, well, maybe probably not thought about it, but now you're asking. I suspect it could be this or that, because I think the last one that happened is maybe when she got exposed to this, for instance. At that point, you might now be asking, should we be arranging an allergy test to confirm these possible trigger or allergens? What advice and explanations might you offer? Would you refer to a specialist clinic, for example, for allergy testing? Obviously, it's a possibility, something you also need to verbalize and explain, that sometimes we might need to consider referring to an allergy clinic, especially if this eczema is becoming severe. She's having frequent bouts of eczema or severe eczema. We might need to do an allergy testing, but to be very helpful, to avoid just casting a net blindly, to be very helpful to keep a symptom diary that can help us, pin down on what exactly to suspect. Is there anything else you would want to suggest? I'll advise them to carry on with the emollients. Use the emollients generously, but of course reiterate that because the steroids can thin the skin and can cause bleaching of the skin, and if you use it too much, there can be systemic absorption and more side effects. I'll advise it should be used very thinly, once or twice a day. But lots and lots and lots of emollients, and then come back to me in a month's time with your symptom diary, so we can go through it together and see if we've identified possible triggers for her rash, for eczema. And of course, you need to also be checking if she's having any symptoms of a more serious allergic reaction, any difficulty in breathing, any wheeze, things like that. The purpose of this case is to explore parental concerns, negotiate an evidence-based plan that is mutually agreeable, and build a trusting relationship with a family that have had cause to doubt the opinion of the GP in the past. So they're not satisfied, they've come back, and you have to build that trust by listening. But you don't have to ever throw your colleague under the bus, because your colleague has done the right thing. Maybe your colleague hasn't fully explored their concerns and expectations. You know what I mean? So you need to do that. You need to go a step further in buttressing what your colleague has already done, which is a right management plan, but going further, thinking broader, and carrying them along that thought process, and inviting them for a follow-up with the symptom diary in a month's time. But obviously they can come back earlier if they think this eczema has got infected. If it becomes very red and angry, if it becomes weepy, if she develops a temperature, she starts being hot and cold, not avoiding her food and drinks, or not really wetting her nappies, if she's just not unwell, come back much earlier, because at that point we'll be thinking maybe she has developed an infection of her rash. Explaining all of those. What are your thoughts on everything I've said? Okay, what are your thoughts on everything I've said? Are you happy with this plan? Thank you for coming. All the best. Cheers. Okay? Be reassuring, be positive, be happy, be a good, happy doctor, and you rub off on your patients. Cheers, guys.